Namaste everyone. Myself Jyotiranjan Sahu, a student of medicine, going to discuss some key points of anatomy. So the first point, upper lateral cutaneous nerve is a branch of axillary nerve. An injury to anatomical snuff box causes fracture of this bone, scaphoid. Muscle of arm causing flexion, adduction and medial rotation, pectoralis major. Testicular artery is a branch of abdominal aorta. Inferior scapular angle lies at which level? T8. Muscle causing adduction at hip joint, gluteus medius. Deep inguinal ring is formed in transversalis fascia. Nerve damage that can cause hypothenar muscle wasting and loss of sensation of medial 1.5 digits, ulnar nerve. Failure of closure of rostral neuropore at 25th day leads to anencephaly. Parotid gland is supplied by this nerve, glossopharyngeal nerve. Killian's dehiscence is formed due to inferior constrictor muscle. Muscle biceps brachii inserts into radial tuberosity. Nerve supplying area between great toe and second toe, deep peroneal nerve. Dermatome supplying area of nipples, T4. Dermatome supplying area of umbilicus, T10. Retraction of scapula is done by middle fibers of trapezius muscle. Nerve supplying cornea, trigeminal nerve. Longest extraocular muscle, superior oblique, 7.7 cm. Shortest extraocular muscle, medial rectus, 5.5 cm. Important bone and their nutrient arteries. Femur, branch of femoral artery, profunda femoris artery. Tibia, posterior tibial artery. Fibula, branch of posterior tibial artery, peroneal artery. Clavicle, subscapular artery. Radius and ulna, anterior interosseous artery. Humerus, profunda brachii artery. Branches of subclavian artery. First part, vertebral artery, internal mammary artery, thyrocervical trunk. Second part, costocervical trunk. Third part, dorsal scapular artery. Weight of some important organs. Pituitary 0.5 to 0.6 gram, that is 500 to 600 milligram. Brain of males it is 1.4 kilogram. Of females 1.27 kilogram in adults. Thyroid gland 20 to 40 gram. Kidney 130 to 160 gram. Adrenal gland 5 to 6 gram. Prostate gland 15 to 20 gram. Length of important anatomical structure. Fallopian tube 10 to 12 centimeter. Bile duct 8 centimeter. Appendix BAG. Spinal cord 45 centimeter. Glands of face and their duct. Parotid gland, Stenson duct. Nerve is CNV. often asked one-liners. Most frequently fractured bone of body, clavicle. First bone to ossify, clavicle. Only long bone which has no medullary cavity, clavicle. All long bone ossify in cartilage except clavicle. It ossifies in membrane, clavicle. Most frequently dislocated carpal bone, lunate. Most frequently fractured carpal bone, scaphoid. Nerve supply of deltoid, axillary nerve. Most common fractured carpal bone, scaphoid, boat shaped. Second most common site of avascular necrosis, ape thumb deformity. Musician's nerve, ulnar nerve, root value, C8 and T1 vertebrae. Laborer's nerve or eye of the hand, median nerve. Root value of radial nerve, C5 to T1, C5, C6, C7, C8 and T1. Winging of scapula, long thoracic nerve. Serratus anterior muscle, paralyzed. Policeman tip hand or porter's tip hand, Erb's paralysis. Klumpke's paralysis, damage to C8 and T1 vertebrae. Strongest ligament of body, iliofemoral ligament. Longest muscle of body, sartorius, also known as Taylor's muscle. Nerve supply of gluteus maximus, inferior gluteal nerve. That is to lumbar 5, sacral 1, sacral 2 vertebrae. Nerve supply of gluteus medius and minimus, superior gluteal nerve. Lumbar 4, lumbar 5 and S1. Vessel used in coronary artery, bypass graft, internal mammary artery. Muscle which is known as peripheral heart, soleus. Locking of the knee by quadriceps or femoris muscle. Unlocking of the knee by popliteus muscle occurs at first stage of flexion. Sternal angle and bifurcation of trachea at T4 level. Arc of aorta begins and terminates at T4 level. Policeman of abdominal cavity, greater omentum. Muscle of horror, platysma. Nerve supply of upper eyelid and tip of nose, V1. Ophthalmic branch of trigeminal. Most commonly nerve, paralyzed, facial nerve, longest intraosseous course. Emergency tracheostomy at tracheal ring 2 to 3, ova released in form of secondary oocyte. Blastocyst formation 5th day after fertilization. Implantation occurs 6th day after fertilization. Completes on 10th day. Liver has 8 segments: caudate lobe, segment 1, quadrate lobe, segment 4, narrowest part of esophagus, cricopharynx at the root of neck. Test which is done to check gluteus medius and minimus. Trendelenburg test. Trigon of bladder develops from mesonephric duct, mesodermal in origin. Pouch of Douglas between rectum and uterus. Parotid gland duct, Stenson's duct. Submandibular gland duct, Wharton's duct. Muscle which opens eustachian tube while yawning, tensor veli palatini and levator veli palatini. Ovarian artery or testicular artery is a branch of abdominal aorta. Most common fracture of humerus, Supracondylar fracture, muscle not attached to apex of orbit, inferior oblique. Which bone does not contribute to medial wall of orbit, zygoma. Which layer of scalp is vascular subcutaneous tissue? Magendie formation drains cerebrospinal fluid from fourth ventricle. Closure of neural tube begins at cervical end. If choice given is multiple sites, then it is best answer. Junction of anterior and posterior horn of lateral ventricle is called trigone and lateral ventricle. Infection of CNS spreads in inner ear through cochlear aqueduct. Posterior communicating artery is a branch of middle cerebral artery. The chorda tympani nerve arises from facial nerve. Broca's area is located in inferior frontal gyrus. Lower angle of scapula lies at level of T7. Nerve injured with fracture of cervical neck of humerus, axillary. Nerve injured with fracture of shaft of humerus, radial. Okay guys, thank you. Let's see in the next video.